Yes, Bia, I think you start.
Very good. Hi, everyone. B. Coleman here. And as most of you know, I am not a homeopath. I just love learning about natural medicine. And I love to share it. So today we are discussing urinary tract infections, UTIs. We have all probably at some point or another had one of these. They're very obnoxious, they're inconvenient, and they're often painful. So I have from Joette Calabrese, that is who I first started learning from online. Ran into her website and just took off from there. So Joette recommends 1 dose of Cantharis 30C twice a day. However, I've also seen her recommend Cantharis 200C. And in fact, my daughter, that is what we have, she has used, and it worked beautifully for her. So Cantharis 200C twice a day. And just as an aside, she also uses Cantharis 30C for cystitis, which may or may not involve an infection. I don't think they're really clear on all the exact workings of cystitis. So now for the Banerjee protocols, they have in their book a 3-line protocols. The first line protocol is Medorrhinum, MEDORRHINUM, Medorrhinum 200C twice a day. They also use separately Pyrogenium 200C twice a day. Now, if there is blood in the urine, they recommend terebinthine, TEREBINTH.
Sure, he's working, so I don't know what time he's got.
Terebinthina.
Yes, somebody has their microphone on. Someone that just says iPhone, they need to turn their microphone off. Terebinthina. And let's see where I've lost my place. That is if there is blood in the urine. Terebinthina 6C twice a day. All of these are taken separately, so separate them by at least 10 minutes. The second line protocol is very simple. So if this one works for you, it's probably the best one because it's just one remedy. This is Thuja 30C twice a day. But if it's an acute situation, there is extreme discomfort every 3 waking hours, and then go back to twice a day as that subsides. The third line protocol, again, this is Banerjee protocols, is Cantharis 200C twice a day. Again, for acute situations or painful urination, this is for uncomfortable or painful urination and frequent urge. The other part of the third line protocol, taken separately, is Chimpaphylla umbellata, mother tincture, twice a day. Chimpaphylla. Okay. CHIMAPHILA. Umbellata. UMBELLATA. Again, mother tincture, and that is twice a day. And that is all that I have. So, Dr. Imran, please go ahead.
Okay, second, we invite to talk Ahwa.
Ahava, welcome.
Okay, hi everyone. Thank you so much for joining us today. My name is Ahava McLaughlin. I am a traditional naturopath, and I'm going to share a little bit on the herbal side of the thing so that you can consider it for your homeopathic protocols. I apologize, I got a call. Okay, so what I wanted to start off by saying is that there are a lot of different pathogens that could be creating havoc in the urinary tract system. And it depends whether it's gram-positive bacteria or let me see, gram-negative bacteria. Gram-positive bacteria, they lack membranes and have a much thicker cell wall to protect them from outside events. Even though it's thicker, they are much easier to treat. The bacteria is easier to treat than the gram-negative bacteria. Gram-negative bacteria is harder to treat. And so that's something to keep in mind. In general, see here, I'm going to bring up my notes. In general, herbals like corn silk, juniper berry, Bidens, second, echinacea is another one, and second, the verbane plant are all great herbals that you can consider when treating urinary tract infections. Another one that's really quite invasive, especially for women, is Candida. And Candida can be very, very hard to overcome. The symptoms come and go, and it goes to any place where there's mucusy, just like on the skin. It can get damp in certain places. It also likes the urinary tract because it's also a damp place in the membranes. So itching, burning, soreness, irritation with whitish patches or discharge are common symptoms, and they can become systemic and affect multiple symptoms. So multiple parts of the body, I apologize. I have seen, for example, Candida in the ears. Also, we know thrush is Candida in the mouth, Candida coming out through the skin. And the vaginal area is just another part which can be hard to treat. Some herbs that are great for Candida are Artemisia, verbenes, juniper, honey, usnea, black pepper, licorice, and reishi, and echinacea. So those are something else, some other ones that can affect the urinary tract system as well. I like to pair juniper berry and Bidens together. That works pretty well for general urinary tract. And I also like corn silk because it cleans up debris and stones. So this one also is very good for cats that tend to get UTIs. Corn silk is pretty imperative for them. And D-mananose, lastly, helps clean up the bladder. So that is also something to consider and having your medicine cabinet. Okay, so I think that's it for today on that. If anybody has questions, feel free to let me know. Check the chat. Okay. All right, so I will pass it off to Dr. Imran, and thank you so much. Okay, no problem, sure. So for Candida, the herbs are Artemisia, echinacea, black pepper, usnea, that's spelled U-S-N-E-A, verbenes, B-E-R-B-E-R-I-N-E-S, juniper, and I think I said Artemisia, yeah, and reishi. is another one. So again, Artemisia, juniper, verbenes, reishi, black pepper, usnea, echinacea. These are all great herbs for candida in the urinary tract specifically. And it's something you would consider taking 2 to 3 times daily. Obviously, if there's a strong infection, you know, you would use wisdom there and see what you could also frequency test, muscle test, and see how much do they use. I'm sure you could use Pal de Arco. I haven't used it, but you know, a lot of these herbs do cross over. Also, another good one is Chanca Piedra, just came to my mind. I've used that for kidney health, which ties into the urinary tract. So Chanca Piedra is also a very, very good one.
Hava, can you make recommendations as to habits that we should be taking to prevent this issue in the first place?
Great question. Yes. Drinking lots of water. You can add lemon to your water, you know, cucumbers or lime. Drinking half of your body weight in ounces daily is imperative to make sure that your kidneys are getting flushed, to the areas getting flushed daily. And also, I know the craze is keto diets and, you know, whey powders and stuff like that for bodybuilding. That can be very, very hard on the kidneys. And that can cause a little bit of a problem and imbalance in pH. Also, another one that can be an issue, let me just see here. Oh, it just came to me and I lost it. Water, the proteins. Okay, maybe it'll come back to me later, but those are some of the main ones that really to look out for. Oh, watermelon is a great kidney and bladder cleanser. I think, asparagus. Asparagus is another great one. So that's something to keep in mind, you know, when you're eating. I always try and buy asparagus at least once a week and eat with, you know, my meals, because that's a great kidney support, you know, urinary tract support. So both of those are really great. And of course, when you're looking for watermelons, make sure that it's not genetically modified because they're very high in sugar. When they are, meaning you want to look for a seeded watermelon versus seedless, because the sugars in that tend to be a lot higher and obviously can cause other issues. Does that answer your question, Dee?
Yes, thank you. Oh, you know what? I'm wondering if, because we as a society consume so much sugar, do you feel that that is a great contributor?
Yeah, I mean, it's like you can only say it so many times and it's like you're drinking water, you know, like it's like, oh, don't eat sugar, but we do it anyways. It's very interesting when I have my clients sometimes, especially with the young kids, everyone asks me, well, all the products that I buy for my kids have sugar in it. You know, when you think of, you know, all the processed little packages for food and stuff. And I'm just like, well, don't buy it. And they're like, well, what am I going to feed my kids? I'm like, oh, you know, you could try fruits and vegetables and you maybe could pop your own popcorn that's organic, non-GMO at home. Send that, you know, get creative in the kitchen and make your own vegetable potato chips and stuff like that, or buy, you know, potato chips that are made in avocado oil or whatnot versus, you know, it's kind of hard, you know, the society that we live in, and the sugar is in everything. So when you think about it, you're having sugar every single day, maybe even as an adult, sugar in your coffee. You know, you're making a sauce for food and it calls for a little bit of sugar. So all of that really adds up. So I tend to just go by, for my kids especially, I don't eat so much sugar, but we do desserts once a week. And that we do that for like a very nice meal that we do on the weekend. And that's it. I don't typically, unless it's like a birthday party or something like a special event, I don't typically let them have sugar in during the weekday. And I kind of tend to stick to that rule. And if I go outside of that, I do notice, not necessarily specifically with kidney infections in my own family. I'm just speaking from my own family per se. That, you know, colds will start to come on, you know, their immune system gets lowered. And as soon as I clean it right back up, they're fine again. So that's, and then of course, you know, the more sugar we have, and then we're not drinking enough water, that's definitely a duo for disaster. And heavy proteins. Heavy proteins are really, really hard on the kidneys.
Very good, thank you.
You're welcome. Thank you so much. Okay, Dr. Imran, thank you so much for having me. I'm looking forward to hearing what you have to say today.
Okay, thank you very much. Hello, everyone. Today we talk about UTI. Symptoms of UTI. Symptoms of lower urinary tract infection, bladder, and urethra. The most typical symptoms is burning or pain when urinating. Second, increase urinary frequency without passing much urine. Third, strong need or urge to urinate, but only producing a few drops of urine. Fourth, urine has a foul odor and is cloudly. Fifth, non-visible or visible hematuria, urine can appear bloody. Sixth, pain in the lower back, lower abdomen, and even the pelvic region will typically make you feel the need to urinate more frequently. Upper UTI symptoms. It affects kidneys. The symptoms are first one, fever and chills. Second, nausea and vomiting. Third, flank pain, pain on either side of lower back between pelvic and ribs. In the bacteria moves from infected kidneys to the blood, it can be life threatening. The condition is termed as a which can cause extremely low blood pressure, shock, and death. So, what is the cause of UTI? A urinary tract infection arises when bacteria gain access to the urinary tract and begin to multiply there. Commonly known as E. coli, a type of bacteria commonly found in gastrointestinal GI tract is the most common bacteria infecting the urinary tract. The bacteria mainly either the urinary tract via the urethra and gut. Other less commonly known as bacteria causing UTI. So risk factor. Following factors make a person more prone to UTI. Women are more likely to contract this disease. Risk factors specific to women for UTI are mentioned here. Anatomy of female. First one is the anatomy of female. The length of urethra is a short and its orifice being quite close to the anus in women makes it easier for the bacteria to spread to the bladder. This leads to higher chance of a urinary tract infection in women as compared to men. Second one is menopause. After menopause, there is a decline in circulating estrogen that causes changing in urinary tract that makes the female more prone to UTI. Some women have urinary tract that makes the bacteria easy to cling to them and are generally prone to UTI. Third, sexual activity. Sexual active women suffer from UTI more times than women who are not sexually active. Fourth, birth control agent. Women using diaphragm for birth control and also those using agents are at higher risk of UTI. Other risk factors include suppressed immune system. People who suffer from conditions like diabetes, high blood sugar are more likely to develop UTIs because their bodies are less capable of fighting infection effectively. Obstruction in the urinary tract, prostate, or obstruction on the urethra by an enlarged prostate can cause insufficient bladder emptying in men, which rising the risk of infection. Most elder men experience it. So now I want to talk some most famous and effective homeopathic remedies which we are use our clinical practice. First remedy is cancerous. Cancerous is among the primary remedy for treating UTI. The key symptoms to look out for while suggesting cancerous is a intense burning before, during, or after urination. There is a constant urge to urinate. Natty urine or urine pass in drops from UTI is also best treated with cancerous. At time, blood in urine can also be seen. So we are commonly use cancerous in 30C and 200C and 1 m according to the patient condition. Second remedy is Eps malfica. Second homeopathic remedy is Eps malfica. Eps malfica for severe burning while passing urine. Eps malfica is the next important remedy for UTI. The person requiring Eps malfica will complain of burning or stinging pain while passing urine, especially last drops of urine cause intense burning. There is also bladder tension of incomplete bladder emptying even when there is no urine left behind in bladder. In some cases, blood appears in urine. So we are commonly use Eps malfica in 6C, in 12C, in 30C, 200C, and 1 m according to the patient condition. So third remedy is sarsaparilla. Third remedy is sarsaparilla. Sarsaparilla. Sarsaparilla for intense burning towards the end of urination. To treat UTI with intense burning when a person finishing urination, sarsaparilla is the most reliable remedy. Other occupying for use of sarsaparilla are snotty urine, urine with pus and blood, and pain in urethra extending to the abdomen. So sarsaparilla we are used in our clinical practice. Sarsaparilla in mother tincture, sarsaparilla in 30C, sarsaparilla in 200C, and sarsaparilla in 1 m according to the patient condition. Third remedy is nitric acid. NITRIC, nitric ACID, nitric acid. For burning during urination with foul smelling urine, nitric acid is one of the most effective remedy for urinary tract infection, where the major symptoms include burning while passing urine that is highly offensive, foul smelling like horse urine, urine is snotty, cloudy, dark, or bloody. So we are use nitric acid in our clinical practice in 6C, 200C, 30C, and 1 m according to the patient condition. Next remedy is sepia. Sepia for UTI in women. Sepia is rated among the most effective remedy for treating UTI in women. CPI suggests when there is cutting pain in the bladder, the urinary stream is weak and the urine smell bad. There is a feeling of the public area. There is a feeling of the public area getting pushed down. CPI is also very useful in cases of chronic bladder infection. It is also recognized as the best remedy for UTI in women going through menopause. So we are use sepia in our clinical practice. Sepia 6C, sepia 30C, sepia 200C, sepia 1 m, sepia 10 m, sepia 50 m, and sepia CM according to the patient condition. So next remedy is Staphysagria for UTI. Staphysagria. Staphysagria for UTI. Staphysagria is the homeopathic remedy for UTI associated with sexual intercourse. Other homeopathic remedies for urinary infection, like so Staphysagria is a remedy for UTI associated with sexual intercourse. So we are use Staphysagria in 6C, in 12C, in 30C, in 200C, in 1 cm according to the patient condition. So next remedy is clematis. Next remedy is clematis. Clemetis. Clemetis. Clematis is very effective for urine infection in patients who have suffered from sexually transmitted disease. So we are used this remedy in 30C, 200C, and 1 m according to the patient condition. So next remedy is colibacillinum. Next remedy is colibacillinum is a specific homeopathic remedy for E. coli infection. It helps in treating the recurrence of E. coli infection. E. coli is a bacteria which is responsible for recurrent UTI. So we are use this remedy is colibacillinum in 30C, 200C, and 1 m according to the patient condition.
Dr. Imran, are you saying COLI and then bacillinum?
Yes.
Okay, COLI. Thank you.
Next remedy is
Would
Nux
you
vomica.
would you repeat those potencies again?
COLI colibacillinum in 30C, in 200C, and 1 m.
Thank you.
Welcome. So next remedy is Nux vomica. Nux vomica, it is an instant homeopathic treatment for chronic UTI in an irritable urinary bladder. It is by burning sensation, cramps, and extreme itching during urination. It commonly causes a person to become irritated and impatient. So Nux vomica we are commonly use 30C, 200C, 1 m according to the patient condition. So next, I want to share some homeopathic remedies for UTI in children. UTI in children. First remedy is borax. Borax is a widely recommended remedy for managing urine infection in children. The main features to use this remedy is that the child cries or screams before passing urine out of pain. There is an increased frequency to pass urine as well. Sometimes there is an urge to urinate at every 10-minute interval. There is also an urgent desire to pass urine. The urine has foul smell. It some causes needing borax. Teeny red particles can be seen on the child's diaper. So I use mostly borax in 12C and 30C and 200C according to the patient condition. Next remedy which we are use a UTI in children, lycopodium. Lycopodium with frequent urine. The remedy is indicated when there is frequent urination. The urine is pale in color. The urine contains foul-smelling sediments. Child cries before passing urine. Pain is felt in the bladder region. In some cases, urine passing. So we are used lycopodium in 30C and 200C according to the patient condition. So next remedy which we are use UTIs in children, Mercor, MERCCOR, Mercor. Mercor is another good remedy for acute cases of UTIs. This remedy can be thought of in cases where the patient is unable to passing urine or has to put in a lot of effort for the same. This remedy can also be expected to given good result in recurrent UTIs in advanced stage of.
What is the second word? You're saying Merc Sol, or is it something else?
Mercor, MERCCOR,
Uh-huh.
Mercor.
Oh, okay, great, thank you.
So we are
So is that corrosivus?
sorry.
Is that Merck corrosivus?
Yes.
Okay.
So we are use this remedy Mercor in 30C and 200C. So next remedy is sarsaparilla when child scream before and during urination. This remedy is recommended when a child screams before as well as while passing urine. The child can pass urine only while standing. Urine passes in the stream. A severe pain at the end of urination may be felt. The bladder region might be distended or painful to touch. Urine may pass involuntary at night. Urine may contain white sand like particles. So we are use sarsaparilla, SARSAPARILLA, sarsaparilla in 30C and 200C according to the patient condition. So fourth remedy is canthus, CANTHARIS, canthus, for pain, burning during passing urine. Canthus is a very effective remedy when there is a marked pain or burning while passing urine. Pain may also be felt before and after passing urine. The child doubles and screams with pain. There is a pain in the bladder along with frequent urination. There is an urge to urinate even if there is little urine in the bladder. Shortly after passing urine, the urge to pass urine is less while sitting but increase when standing or walking. In some cases, needing it, urine passes drop by drop. So Canthras I use in my clinical practice in 30C and 200C according to the patient condition. So fifth remedy is Apis mellifera, APIS, MELLIFICA, Eps Malfica, for burning when passing last drops of urine. This remedy is well indicated when a burning sensation is felt while passing the last drops of urine. There is a frequent urination. Urine passes with much difficulty. The urine may also pass. In some cases, itching in urethra may. So we are use Eps Malfica in 6C, in 12C, in 30C, and 200C according to the patient condition.
Can
So
you spell
next
that last
remedy,
one? Can you spell the last one?
It's
Eps Malfica.
Apis mellifica.
Apis Malfica, APISMELLIFICA, Apis Mellifica. In 6C, in 12C, in 30C, and in 200C according to the patient condition. So sixth remedy is Sanicola, SANICULA, SANICULA, Sanicola. When child cries before urinating, this remedy, like borax, is indicated when a child cries before urinating. There is an urgent desire to pass urine. Urine passes in small quantities at long intervals. The child may strain to pass urine when passing stool. So I use only this remedy in 30C. So seventh remedy is Creosote, Creosote. Creosote with offensive smelling urine. Creosote is a valuable remedy when the urine smells offensive. There is frequent urination during day. The child has to hurry up when the urge to urinate. There may also involuntary urination at night during sleep. So I use this remedy in 30C and 200C according to the patient condition. So next remedy is Merxol. Next remedy is Merxol. MERC space SOL. Merxol. Merxol with frequent and urgent urination. Merxol can be considered in cases with frequent and urgent urination. The child needing it shows increased frequency to pass urine but passes only a little urine at a time. There is an urge to urinate every hour. There is also a need to hurry to urinate, otherwise urine passes on its own. The urine flows in thin stream. The child tend to hold the urethra and cries from pain. Pain or burning is felt in the beginning of urination in most cases. So I use this remedy in 30C and in 200C according to the patient condition. Okay, now I want to talk. Now I want to share some protocols which we are used in my clinical practice. So first protocol is belladonna 30C, arsenic album 30C, thuja 30C. Belladonna 30C, arsenic album 30C, and thuja 30C. If urine come with burning and in small quantity drops by drops, so I use this protocol belladonna 30C, arsenic album 30C, and thuja 30C. Mix together these three remedies and use 3 times a day. And second one is sulfur 200C and arnica 200C. Mix together these two remedies and use before breakfast.
Use before what?
Before breakfast. Before half-hour breakfast.
What was the first remedy there?
Sulfur 200C and arnica 200C.
Okay, thank you.
If albumin come with urine and with burning, then we are use Kali Sulf 6x. Kali, Kali Sulph, Kali Sulf 6x, 4 pellets, 3 times a day.
So it's Cali Sulf 6X and what else?
4 pellets, 3 times a day. If urine color blackish, if urine color blackish, bloody clots come with urine, then we are use scale car 30C. Scale car SECALE scale car 30C 3 times a day.
Are you saying carb, CARB?
No, scale car COR.
Ah, okay, thanks.
And second remedy is terebinthina. 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 Terebinthina 30C. Separately, these two remedies 3 times a day. If burning feel after urination, if burning feel after urination, then we are use Mercar MERC MERC space CORR Mercar 30C 3 times a day, and Lilium tag LILLIUM Lilium TIG Lilium tag 30C Separately, these two remedies 3 times a day.
Would you repeat that one again?
MERC Marak, CORR Marak or 30C. Second remedy is Lilium tag. LILLIUM space TIG 30C.
Taken together?
Separately, these two remedies we are used separately. A
Three,
5 minute gap between two remedies.
3 times a day?
Yeah, 3 times a day. If infection in urine, and during walking, urine pass drops by drops. Due to infection, urine pass during walking drops by drops. So remedy is Prera breva. Pareira space Brava. Prera breva in mother tongue. Pareira space Brava. Prera breva in mother tongue.
Would you
7
type
drops.
that one out? Could you type that one out, please?
Yes. Prera breva. Mother tongue. 7 drops 3 times a day in half cup of water before half-hour meal. If burning in urine smelly, and also fever. If feel burning in urine, smelly urine, and also fever, so we are use this protocol Belladonna 200C, Puja 200C, Arsenic album 200C. Mix together these three remedies and use 3 times a day. Silicea 6x, SILICEA, Silicea 6x, and Calimere 6x. Mix together these two remedies and use 3 times a day.
What was the first remedy?
Silicea 6x and Calimere 6x.
Ah, okay. Silica. Okay.
So next protocol is if smell in urine, burning, fever, and also blood come, fresh blood come with urine. If smell in urine, burning in urine, and patient feel a fever and blood come with urine, then I use this protocol phosphorus 30C, PHOS, PHORUS phosphorus 30C, and MILLEFOLIUM millifolium 30C, millifolium 30C. Mix together these two remedies and use 3 times a day. If infection in urine due to gonorrhea, if infection in urine due to gonorrhea and urine come drops by drop, and also pus come with urine, then I use this protocol Mercor, MERC space COR, Mercor 1M 1 dose, Mercor 1M 1 dose, and Thuja 30C and Canthus 30C. Mix together these two remedies and use 3 times a day.
So you had Mercor 1M and then Thuja 30C. And what was the third one?
Canthus 30C.
What was that?
Canthus, Canthoris, Canthus 30C.
Cantharis.
Oh, okay. Thank you.
Mhm.
So next protocol, same next protocol in biochemic cell salt. Mercor 1M 1 dose, Mercor MERCCOR, Mercor 1M 1 dose, Calcarea Fast 6X, Natrum Fast 6X, Kali Fast 6X. Mix together these three biochemic cell salts and use 6 pellets 4 times a day. 6 pellets 4 times a day. So, anyone have a question about this topic?
I have a question. There's a little girl that she's had extreme burning, except when she goes to the bathroom. And they have taken her to a functional medicine doctor and did a urinalysis on her, and it came out clean for no UTIs. And from what I understand, it happened about 2 months after she had antibiotics for an ear infection. And her mom has tried her on several remedies like Cantharis and Staph, and a few things when she was reaching out to someone else and thought it was a UTI in the beginning. And would you have any suggestions in this case? Would it be different or? And it says that she burns all the time except when she goes to the bathroom. And her disposition has changed from a sweet child to being irritable and melting down a lot.
Okay. So can you tell me about her
And
urine flow?
I don't know any more than they say that there's no discharge, no smell, and nothing unusual, just the burning except when she pees.
Uh, my question is, what about a urine flow?
Okay, I don't know that. But I can find that out in just a minute.
Okay, better you ask her and send me her whole case in my inbox, so I will try to find her right remedy. I send
Okay,
you some question list and ask her and send me answers. I hope I will try to find her a right remedy.
okay. And from what I understand, there's nothing odd about the flow, but I'm asking her mom again in specifics.
I send you a question list.
Okay. And the mom just did response. It said it's clear and not cloudy,
Okay.
regular. So that was the case.
So urine pass with pressure,
Um,
or urine pass by drops, or urine pass with pressure, urine color, urine smell, urine whitish, yellowish, blackish, greenish. So what type of her urine color? How much water she drink in a day?
okay.
So what type of weather there? So, so she feel burning during past urination or
Um,
after or before.
she says
So
that's
tell me about her diet. So actually, I need a whole case information.
Mhm.
So after that, I hope I suggest something.
Okay. Yeah, I know that her mom's cleaned up her diet. They eat pretty healthy, and she just said that the urine is regular. Um, and I imagine with the water amount, she drinks the normal amount. I teach her at a homeschool.
Normal
Yeah,
normal amount. What is the quantity of she drink water? 1 liter, half liter, 2 liter in a day, and how
right.
many times she pass urine? So she feel burning during urination or after pass urine or before.
I I'm told she feels
And
it
she
all the time except when she's going to the bathroom. Like that's the only time she doesn't feel any burning at all. Otherwise, it's all the time, is what I understand. And I know she went to several doctors, and they ended up giving up on her.
so what is the color of her urine?
It's would be the regular color, like that light yellow.
Okay. And what about smell in urine?
No smell.
Okay. So she cry before passing urine or after passing urine or during passing urine.
It's from what I understand, it's not when she's passing the urine, but it's all the other times. Like that's when she feels relief.
So she feel cry.
During the day, but not when she passes urine. So it's a seems a weird case.
Okay. So she is a happy girl or she feel irritation, restlessness.
Yes, she's having a lot of meltdowns for a 7-year-old little girl, and her mom said that she normally does not have any meltdowns.
Okay. So we start Pulsatilla nigra 30C, 3
Mhm.
time a day.
I'm
First,
sorry.
give her this Pulsatilla nigra,
Okay.
Pulsatilla, Pulsatilla, Nigra, Nigra,
Okay.
30C. Give her this remedy in 30C 3 time a day for 7 days. After 7 days, tell me about her condition.
Okay.
So, anyone have a question?
Thank you so much.
Okay, always welcome. Anyone have a question about this topic?
I have a question, Dr. Imran. You state that you give remedies, you state the different potencies of your remedies according to the patient condition. Do you see the severity of the condition, the higher the dosage or the higher the number on the remedy? Such as you give up to a CM remedy, do you feel that if the patient is suffering terribly that you give a higher dosage?
Okay. So, friendly speaking, I always use, if acute case, I use 30C and 200C, and I repeat these remedies every 10 minutes or every 30 minutes. So mostly I use these remedy in 30C and 200C in acute cases. And in chronic cases, if I suggest in 1M and CM, so if I, for example, if I suggest someone in 1M potency, then I repeat second dose after 1 month, maybe after 2 months. If I suggest someone to use in CM potency, then I wait 1 to 3 months. Then I repeat a second dose if patient need. But most of the time, I want to stay in 30C and 200C.
Great, thank you for clearing that up.
Okay, always welcome. So anyone have a question? So now I want to say thanks to everyone. Next Sunday, same time, we meet with new topic. So thank you very much to all.
Thank you, Dr. Imran. Appreciate you.
Always welcome.